Have you ever stopped to think about how a vaccine actually reaches a newborn in a super remote village miles and miles from the nearest city? Or how a pregnant mother gets the care she needs without ever having to travel far from home? Well, today we're going to unpack the architecture of community health, that incredible and often invisible system that makes it all work. So, this is the big question, right? How do you build a safety net that covers not just the big cities, but every single village, every remote community? How do you make sure that where you live doesn't decide whether you get good health care? That's the puzzle we're going to piece together today. And the answer doesn't start with big hospitals or complicated government policies. Nope, it starts with people. The very foundation of this entire system is a team of dedicated frontline workers who actually live and work right there in the heart of the community. So first, meet the ASHA worker. She is the crucial link, the bridge between her community and the formal healthcare system. And she's so much more than just a health worker. She's a trusted neighbor, a guide, an advocate. Picture her going door to door, counseling a new mom on breastfeeding, or making sure a child gets their life-saving shots. She's the one who turns policy into real-world practice, one family at a time. Now, here's where the design of the system is just brilliant. And Asha isn't some outsider sent into a village. She is from the community she serves. She speaks the language, she gets the culture, and she's already earned the trust of her neighbors. This isn't just about delivering healthcare, it's about empowering the community itself. That's really the secret sauce that makes the Asha so effective. Okay, next up, we have the Anganwadi worker. She's another key player on this frontline team. Her mission is laser-focused on the most critical time in a person's life, from pregnancy all the way through early childhood. She's the one making sure kids get vital nutrition, tracking their growth, and really building the foundation for a healthy life. And then we have the local DIs, or the traditional birth attendants. For generations, these women have been a trusted presence during childbirth. Now, instead of replacing them, the health system decided to embrace their wisdom. Through training programs, their traditional knowledge gets blended with modern medical practices. And the result? Safer deliveries and healthier moms and babies. It's just a fantastic example of building on the strengths that are already in the community. So you see, it's not about just one person. The ASHA, the Anganwadi worker, and the DI, they form this powerful, interconnected team. They're literally the eyes, ears, and hands of the health system right there at the village level. They are the human foundation that makes everything else possible. All right, so we've met the incredible people on the ground. Now, where do they connect their communities to the bigger health system? Let's move up one level and check out the actual physical places where care is delivered, the local health hubs. Our first stop is the subcenter. This is healthcare at its most grassroots. It's the most local, most accessible health facility you can get, often serving just a few thousand people in a handful of villages. Think of it as the community's front door to the entire healthcare system. And this image here just perfectly captures the huge role a subcenter plays. Let's just follow the journey of a mother and her child. It all starts with antenatal care, regular checkups, and support during pregnancy. Then it helps ensure a skilled professional is there for the birth. But it doesn't stop there. After the baby is born, there's postnatal care, home visits, counseling, and of course, the full immunization schedule. It's a seamless flow of care, all coordinated right from this local hub. But what happens when a health problem is a little more complicated than what the subcenter can handle? Well, that's when we take the next step up the ladder to the primary health center, or the PHC. This is where the medical firepower really starts to increase. The key difference at the PHC is the team. You can see it right here. Now we have a qualified medical doctor, an MBBS, along with a team of nurses, a pharmacist to hand out medicine, and even a lab technician for basic tests. This is a total game changer. It means the community now has access to a much higher level of care, right there in their own backyard. And of course, with a stronger team comes a much bigger mission. A PHC is way more than just a clinic you go to when you're sick. It's the nerve center of public health for the whole area. From running national health programs to making sure the water supply is safe, the PHC is responsible for the overall well-being of the entire community. So we've seen the frontline workers and the local hubs. But how do all these pieces fit into the grand scheme of things? All right, let's zoom out and look at the complete three-tiered structure of community healthcare. This slide lays out the brilliant logic of the whole system. Everything we've talked about so far, the ASHAs, the subcenters, the PHCs, that's all primary care. It's your first stop.
If you need something more complex, you get referred up to secondary care, which is usually a district hospital. And for the most serious medical issues, you go to a tertiary care center, like a big city medical college hospital. This creates a really clear and logical journey for every single patient. You always start with the most local, accessible care possible. You only move up to a higher level when you really need to. It's just a smart, efficient system designed to get you the right care in the right place at the right time.
So we've seen the what and the how, but what about the why? I mean, this whole intricate system wasn't just built by accident. It's guided by a really powerful set of core ideas. Let's dig into the philosophy that holds it all together.
This isn't just a blueprint for a healthcare system. It's a statement about a fundamental human right. At its heart, this whole mission is about making sure every single person has the chance to live a healthy life. And that mission is built on some really powerful people-first ideas.
Here they are, the 4 pillars holding this whole thing up. First, equitable distribution. This is the radical idea that healthcare is for everyone, no matter how much money you have. Second, community participation. This is the ASHA worker in action. It's about empowering people to be active partners in their own health. Third, intersectoral coordination. This is the understanding that health isn't just about doctors. It's also about clean water, good food, education, you name it. And finally, appropriate technology, using solutions that are affordable, adaptable, and actually work in a rural village.
And this powerful definition just brings it all home. Primary health care is about making essential care universally accessible. But it doesn't stop there. It has to be done with the full participation of the community, and at a cost that people and the country can actually afford. That right there is the grand vision of the architecture we've explored today.
We've seen how this whole system is designed to empower the community. So I'll leave you with this question to think about. What's the one most important action your community could take to shape its own health? What's the first step you could take to build a healthier future right where you are?